Welcome to Adapt NCLEX. This video is a video you want to watch for prioritization. We're going to review concepts, straightforward concept you have to know for your exams with this test-taking strategy. And I'm going to use prioritization to illustrate that. You like to stick around and watch this. I don't want you to miss any question on prioritization. So let's get to it. The first thing I want to do is test-taking strategy. And my secret sauce is this, pathophysiology. Pathophysiology, as you can see, there's two words put together. There's a pathological manifestation and there's a physiological manifestation. That means every disease process, there has to be a pathological problem. And out of this pathological problem, you will see a physiological manifestation of that disease process. So as you study, I want you to pay attention to what is causing the problem of the disease. And if you know, you'll be able to deduce the physiological manifestation. And what is that physiological manifestation? You can tell me about the risk factor of that problem. If you know the risk factor, then you can teach the patient things to avoid. That's your teaching right there. And then if they do something wrong, you can intervene. Teaching, intervention, and risk factors. And this is part of your education. And as you can see, this is what they give you, SATA and prioritization. So when you know the risk factors, you can figure out the prioritization. That means the priority information for that disease process. What is in the pathological manifestation that you should pay attention to. If you see it, you know the patient has this disease. If you see it, it becomes a problem for the patient. This is all you need for your bones. Whatever the problem, maternity health, whatever, mental health, everything has this pathological process. And you can come in with pharmacology. I can know, if I know the pathology, I can use the pharmacology to fix it. That's your secret sauce. So this is a short and dirty. If you need more, just come to Adapt NCLEX. You get used to this fact. So these are the concepts, straightforward concept. And I'm going to use what I talk about right now to answer each question, going down to the pathology. When they give you a question with the prioritization, divide it into two. Okay, 4 clients present to the emergency room. They are pediatric patients who need immediate intervention. Divide it. I said this for you to come to your background and figure out what is the problem. Projectile non-bilious emesis and a BUN of that. You have to make the diagnosis. What disease process give you projectile non-bilious emesis? This is pyloric stenosis. And the kid, that's what? BUN 30. That means kid is dehydrated. That's all. That's what he's saying. Episodic abdominal pain and what? Mucus stool with blood. You have episodic abdominal pain, buzzwords, mucus stool with blood. This is what? Etanercept. That's all. And this is Carangella stool. That's what the patient is having. Right lower quadrant pain at McBurney's point and temperature of 101.5. This is the umbilicus. This is the anterior superior iliac spine. McBurney's point is here. If you have pain here, and it's on the right lower quadrant, and you have fever, I know you have appendicitis. These are all concepts. I went to the pathology, and I came out with the physiological manifestation. Bilious emesis, abdominal distension, and no meconium. This is the same. This is the kid coming. This is the small bowel, large bowel. And then you go to your colon, and this is the rectum. The sphincter here does not move. So this colon is massive. So the belly is going to get distended. You're going to vomit bilious because it's below the stomach. And you're not going to pass meconium. This is what? Ashburn disease. That's all. So who do you think as a problem, you got to be sharp. Be sharp moment right there. Dehydration, we can give you something. Ash prone, we need surgery later to give you a colostomy. Appendicitis, we have time, we give you antibiotic to take care of you. Interception, too much ischemia. If you don't do it right away, it will have perforation. So who do you see? That one. Concept based on pathophysiology. That's what you should do. Number 2. This is another NCLEX concept about GCAs. All of them, 4 clients on the neuro ward who need immediate intervention. 5 patients all have GCS of 9. That means they are sick. That's why I told you, divide into 2. What is the situation? This is to illustrate to you that anybody with the brain injury, there's 2 things you should never forget. Avoid secondary brain injury. And how do you do that? Avoid hypoxia and avoid hypotension. Those are the two things you should make sure it never happen. Temperature of 98 is fine. Respiratory rate of 18 is good. Systolic blood pressure 85 is hypotension. Saturation of 89 is hypoxia. Tachycardia is good. You don't want a brain injury patient to be what? Bradycardia. When they're bradycardic and hypertensive, they have Cushing phenomenon. They're herniating. So I want to make sure there's no hypoxia, no hypotension that will cause secondary brain injury. So this and that are the patient you need to see. Number 3, what do we have? 4 clients present to the medical surgical ward who need immediate intervention. They are the same patient. All these questions are designed to tell you to pay attention to when you look at the disease process, what is the most important thing you should worry about. And that's what my design for these questions. So look at it. They all are what? Anorexic. So anorexic. What is the most important thing you should worry about this patient? When they come in, their potassium is low. So you worry about it. Hypokalemia. When you start feeding them, their phosphorus will get low. That's the one you should worry about. If you don't, they go into refeeding syndrome. True, that's what is going to consume their phosphorus. So anorexic patient purging 3 times in the morning, I'm not worried about you. Good luck with that. We'll take care of you. They always bradycardia, so don't get fooled by that. They always bradycardia. They never tachycardia. They refuse to eat, fine. But if they have class 3 edema, this is a sign of what? CHF. That means they have complication from refeeding syndrome. This is key. They don't have edema. As soon as you see facial edema, leg edema, they go into CHF from refeeding syndrome. Their phosphorus is low. You have to do something about it. So this is a sign of refeeding syndrome, and you're going to CHF. So you have to see this patient. Concept on anorexia. Number 4, what do you see? And let us become aware of the following client. It will be a priority to follow up with what? Divide it into 2. Client with what? Angina pectoris, prescribe what? Metoprolol. Patient who have angina usually prescribe beta blocker in order to slow down the heart, control the contractility of the heart and the workload of the heart, and that prevent ischemia. It's a concept you have to know. So this patient is okay. If you have a heart failure too, the same thing. To take away the workload of the heart, we put them on beta blocker unless they have decompensated heart failure. That one, you don't do that. So this patient is okay. If you have a heart attack, the same phenomenon. The heart that is injured, the portion of the heart that is injured, now we're going to slow down the heart. We don't want it to speed. Otherwise, you will get more injured. So they get beta blocker. But if you have 2nd-degree heart block, test-taking skills. I've eliminated 1, 2, 3 based on pathophysiology. Therefore, I have to select number 4. No matter if I understand the answer choice or not, you got to pick it. Second degree heart block. The heart is already slow. They've been blocked. They have a foci that is slowing down the heart. If you put them on a beta blocker, you're killing them. So 4 is the right answer. Number 5. A nurse has become aware of the following client. It would be a priority to follow up with this who. Same thing. Transurethral resection of the prostate 2 days ago, and I have clot in the Foley. Keyword, 1 to 3 days, you're supposed to see clot. After 3 days, 4 days, when you're seeing clot, patient is bleeding. This one is suspected. We just need to increase the flow of fluid to wash the clot out. But 1 to 3 days is okay. So don't worry about it. Exploratory laparotomy 5 hours ago, I'm complaining of what? This is a distractor, severe incisional pain. I whack your belly. Of course, you're going to have pain. We got to give you some medication. Don't worry about it. T3 spinal cord injury 3 days ago, and now with what? Diaphoretic, complaint of headache. This is ICP manifestation. Anything injury above T6, and they present like that, tachycardia, bradycardia, diaphoretic, headache, hypertension, they have autonomic dysreflexia. First thing you do, upright as much as possible. High phallar position, then you check their bladder, their Foley, and then you check their rectum and remove any restrictive dressing from them. Check their vitals 1 to 2 minutes, and then if still, you treat it with antihypertensive. But number 1 is to put them in a high phallar position. This patient is sick. Laminectomy 2 days ago, and feet are still normal. Yeah, if I whack your spine, I did a laminectomy, try to fuse it together, you're going to be numb for some time before you gain some function. Don't worry about the numbness. 3 is your right answer. It's the most dangerous, and you are being sharp if you pick it. Same concept. Number 6, break into 2. Who is a priority? Be sharp. I have COPD. When I'm walking, I'm doing purse slip. Excellent. That means you're prolonging your expiration to allow exchange of what? Oxygen. This is what COPD patients should do. Don't worry about it. I have GBS, and I've increased my vital capacity 2 hours ago. That is excellent. Vital capacity is maximum amount of air you put in your lung and maximum amount of air you exhale. That means this guy does not have a lung function and problem. Therefore, it's good. The only way you worry about them if they have airway issue. It's not having airway issue. Total abdominal hysterectomy 12 hours ago, and I'm saturating 1 pad in 6 hours. Well, that means I'm not bleeding at all. If I'm saturating in 15 minutes, yeah. Multiple pad in 1 hour, yeah. But 1 pad in 6 hours, you're doing good, ma'am. Same thing. Test taking strategy, 1, 2, 3 is eliminated. Therefore, I have to pick 3, 4, whether I like it or not. But you get to see, I hide the answer choice. It's very confusing. Pericarditis and systolic blood pressure, 20, higher during expiration than inspiration. When you have pericarditis, there's only thing you worry about. There's only one thing, okay? Cardiac tamponade. That's all you worry about. So if the heart does not push blood anymore because it's being constricted, that is all you worry about pericarditis. And one sign of pericarditis is what we call pulsus paradoxical. That means when you take a deep breath, your blood pressure systolic would drop like 20 points. When you exhale, it go back to normal. So this is a classic of pulsus paradoxical. Other features is a narrow pulse pressure. You have JVD, you have hypotension. These are Beck's triad. The Beck's triad, everybody knows about what? JVD, okay? They have hypotension, and they have muffled heart sounds. This is what everybody know about. But there's this, pulsus paradoxical, that you have to worry about. That your systolic blood pressure will drop during inspiration And so this patient is in cardiac tamponade. Is number 4. Number 7, 4 clients present to the emergency room who need immediate intervention. I told you from the beginning, these are all concepts that you got to already know. I'm trying to figure out if you get it. Concept, you wake up in the morning, you should be able to figure out. I give you the same day, 2 days, they all have sore throat, they all have temperature. So you can say, oh, who temperature is higher? They are the same. Keywords, it's a concept you have to know. Excessive runny nose, this is RSV infection. Backing cough, you know this is croup, right? Atriagia, that's regular flu. And if you are in a tripod position, you know what it is, epiglottitis. Who is sick? Who among us is sick? You got to be sharp. It's this guy in the tripod telling you he can breathe. Help me out there. Number 8, 4 clients in the pediatric ward, the same concept, right? Who do you see? Break it into 2. I'm giving you immunoglobulin because you have what? Kawasaki disease. That's the treatment for that. You give the immunoglobulin or aspirin. That is the treatment. We are doing good when we're doing that. We're doing what we're supposed to do. And therefore, there's nothing you need to worry about. We're treating this patient as expected. So therefore, you don't need to worry about it. I give you IV narcotic, hydromorphone for sickle cell crisis. Don't give the patient Tylenol. Give them stronger medication that will help with their pain. They have true pain. So this patient is fine. Clarithromycin for a patient with the strep pneumonia who has penicillin allergy. Keywords, penicillin allergy. If you don't know them, there's antibiotics. They're very easy. They start with the C, sulfoxamine, tetan, ceftriaxone. They are penicillin derivative, or you can see xylin, amoxicillin, ampicillin, penicillin derivative. If you are allergic to that, you should not get it. Test taking skills. This does not look like a penicillin derivatives. Therefore, I'll take this. I don't need to worry about it. Digoxin for 14-year-old with anorexia for 24 hours. The same thing. Test taking skills. 1, 2, 3 is eliminated. I got to pick 4. Even if I don't understand, pick it. Digoxin, one of the number 1 symptoms is GI symptoms. If the kid is not trying to eat for 24 hours, that tells you it's becoming toxic. So that's GI symptoms right there. Pick it. Number 9, key concept. As I say, divide it into 2. Several clients need vaccination. Which clients need priority intervention? Whenever you see this vaccination issue, think about immunocompromised states and contraindication. That's all. So you're giving somebody typhoid vaccine for clients who receive cefepime. This is just pure content of this antibiotic. When I give you cefepime, you can get typhoid. It's becoming ineffective. So you have to wait at least 3 to 6 months before you can get it. So this patient is a problem. We have to intervene. You can't use it. It becomes ineffective. Okay. Nasal flu vaccine for a client who receive what? Immunoglobulin. Immunoglobulin, when you receive it, you are immunocompromised. Okay. You cannot get a nasal vaccine. This is what? A live vaccine. This is also a live vaccine. You can't get a live vaccine when you get cefepime. This is also a live vaccine. Nasal flu, you can get it. So if you do that, the patient is going to get sick because they are immunocompromised. Oral polio vaccine for a client who is pregnant. The same thing. Pregnant lady is immunocompromised. He cannot get oral polio vaccine. Etanercept. This is immunomodulator. Use it for IBD, Crohn's, rheumatoid, and everything. You are immunocompromised. You cannot get a live vaccine. Varicella, a live vaccine. CD4 count less than 200, you are immunocompromised. If the CD4 count is greater than 200, yeah, they're good. But this is immunocompromised. All of them are in trouble. Number 10. What do you have? 10-year-old client present to the pediatric emergency room who need intervention. They are all 10-year-old, divided, and they all have 2 days of diarrhea. So don't worry about it. Then you look at the concept base of what you think. If they all have diarrhea, they are dehydrated. If you have mucus membrane dry, you dehydrated. If you have capillary refill greater than 2 seconds, you are dehydrated. 3 seconds, you dehydrated. If you tachycardic, you dehydrated. But if you're lethargic, you pass dehydration, you get in shock. So number 4 is a priority. These people, this guy is in shock, so I got to pick him. Number 11, concept you need to know. A nurse is caring for 4 clients in the emergency room in the med-surg unit. Which client situation need priority intervention? I said this to let you know how they can trap you. Think about it. BMP, they all have BMP that is elevated. When the BMP is greater than 100, they have CHF. So BMP of 200, you have CHF. That means all these people have CHF. The number doesn't matter, whether it's 900, 1 million, 1,000, whatever. Don't worry about it. What is the situation? I have CHF, I have leg edema. Well, that's fine. That's what I expect, right? That's what is expected. That's what is expected. So don't worry about it. BMP, CHF, again, 4 pounds in 2 days. That means I'm fluid overloaded. That's fine. The same thing, BMP 105, but I have pink fluid sputum. I'm drowning now in my lung. I just don't have CHF. Now I'm drowning. You know this is a priority right there. CHF, again, 7 pounds in 5 days. That's the definition of fluid overloaded. So this and that, they are fluid overloaded. But this guy is past fluid overloaded. Now he's having lung symptoms. So number 3 is your boy. Number 12, same thing. And nurse is caring for 4 clients in the med-surg unit. Which client situation need priority? Divided. This is your body. Right upper quadrant pain, this is your diaphragm, this is your leg. Right upper quadrant pain, I have fever and a white count. So this is what? Anatomy, pathophysiology. If you have pain here, that's where your gallbladder is. The patient has cholecystitis. Infection and white count, this is cholecystitis. Do you worry about it? No, right now. Left lower quadrant pain here, okay? Fever, inflammation around the sigmoid, diverticulitis. It's nothing to worry about. Nothing in the statement telling me patient is suffering. Right lower quadrant pain here. You have temperature and a white count, appendicitis. Mid epigastric pain here. And your amylase is 1,000, okay? Pancreatitis. But what is the problem? Your lung is full with fluid. Yeah, I got to see you. The other ones, they're good. We will take care of them. But your lung is a problem. We got to fix you. Number 4 is the right answer. 4 clients are in the emergency room. Which client situation need a priority intervention? Same thing, divided. I'm trying to get you to understand how they can trap you. And there's a bunch of words you have to know. Some of them, they are distractors. Just look through and see, is this, if I have 1 second for one patient, who would I give it to? That is what a B sharp is. If you don't know it, check my YouTube and learn it. And you will be golden in prioritization, which is bulk of your exams, even whether it's pharmacology or anything, safety, anything like that. So appendicitis, right? And pain at the McBurney's point. This is just a trap, okay? This is the belly button. This is the anterior superior iliac spine. This is McBurney's point. You have appendicitis. I should expect you to have pain at the McBurney's point. That is the pathophysiology. Don't worry about it. Don't even worry about the white count. Cholecystitis with right upper quadrant pain and temperature. I have hiatus, I expect fever. I have hiatus, I expect right upper quadrant pain. So forget about it. Appendicitis, temperature of 102. Itis, 102, fine. But then there's a sudden resolution of the lower quadrant pain. It does not have a pain anymore. You should worry about it. That's perforation. Let's look at the last one. Cholecystitis, okay, here, and I have Murphy sign, temperature of that. The Murphy sign is the same as the right upper quadrant. That's you push on the right upper quadrant, and then they take inspiration and rest. And the pain, the gallbladder touches the diaphragm and they stop breathing. Inspiration and rest. That's what you expect. So this is not a problem. 3 is your answer choice. Number 14. 4 clients with AFib present to the cardiology clinic for a follow-up. Which client situation need intervention? This is pure content. All of them are in amiodarone. If you check my YouTube site, you will know this is a board favorite medication you should be comfortable with. When you see amiodarone, just write P clone. P is pulmonary fibrosis. C is cardiotoxicity. L is the liver toxicity. O is basically optic neuritis, basically. N is neuro. E is what? Endocrine. D is dermatitis. That's all. Which one is number 1? Is P. When you are on amiodarone, you'll be cloned. P, clone. Pulmonary fibrosis means you are being cloned. Therefore, AST is the liver problem. Don't worry about it. TST is the endocrine. Don't worry about it. Excessive cough, yes, that's pulmonary symptoms. That's a problem. Dermatitis, don't worry about it. Worry about being cloned. That's your pulmonary symptoms. So number 3 is your friend. Number 15. A nurse is caring for the following client. Which client situation need immediate intervention? Same concept. I want to see if you understand peripheral venous disease and arterial disease. If you have PAD and you have calf pain after walking, this is claudication. That's what I expect. You have a PVD, peripheral venous disease. There's too much blood flowing to your leg. So supposed to see edema. I'm not worried about it. If you have PAD, less blood flow into your leg, you get pain when you walk. But if you have a pain at rest, that means your leg is dying. I'm worried about this. PVD, if there's too much blood going to your leg, you're going to have changes in the color. Blood will leak into the tissue, it breaks down into hemoglobin. Hemoglobin is pigmented, and you have bronze pigmentation. So 3 is your answer. Concept you have to know. That's all. That's what I'm doing with these questions. I'm not doing anything you've never seen before. It's the same thing. I'm trying to keep on hitting a target that when you know it, I mean, there's so many information YouTube, but sometimes there's things you got to know, you know. I'm trying to break through the noise and say, this is what you know. If you know it, you have a weapon to ace your exams. And nurse is caring for the following client. Which client situation need immediate intervention? Select or apply. This is pharmacology. And I made this really hard. Most of the questions are hard, but I made it so that this one you can think. If you have CHF, okay, like I said, divided, and you're digoxin, okay, and your magnesium is 1, yeah. And when you're on digoxin, you can make sure that your magnesium is normal, your potassium is normal, and your calcium is normal. Don't go up on it, don't decrease it. Keep potassium normal, magnesium normal, calcium normal. At the same time, digoxin causes QT prolongation. Magnesium from 1 will cause QT prolongation. So I got to worry about you. If you have chronic kidney disease and you're hypotensive because your hemoglobin is 8, this is a trap one. Don't get trapped. When you have chronic kidney disease, I don't expect your hemoglobin to be 14. I expect it to be like 8, 7.8, 9. So you are anemic because you cannot make erythropoietin. So we giving you hypotensive to help you make what? red blood cell. So this patient is good. You don't need to see him. Schizophrenic patient on what? Clozapine and WBC is 5,000. This may be a trap for some people. When you have schizophrenic, we put you on second generation antipsychotic. What number one thing you should worry about clozapine? Agranulocytosis. The definition is 3,500, less than 3,500 of WBC. This patient is 5,000. Is good. Asthma on albuterol and a potassium of what? 3.6. When you have asthma and you have albuterol causes hypokalemia, right? So this is what is expected. It's 3.6, it's 3 normal. So don't worry about it. Hypertension on what? Epinephrine, right? And a potassium of what? This. You have to recognize this. This is K sparing. This is potassium sparing. This will keep your potassium high. The potassium is 3.5. It's going to go high. So don't worry about it. Chlorothalidone. You have to recognize this. This is what? Hydrochlorothiazide derivative. So that is thiazide. One of the signs is common symptoms for thiazide, I call it hypergluc. That means their glucose goes high, their lipid goes high, their uracil goes high, and calcium goes high. Glucose is high. Don't worry about it. Hypergluc. Hyperlipidemia on atorvastatin and CK of 20,000. When you are what? On statin, there's 2 things you should worry about. Myopathy, that means muscle pain, and rhabdomyolysis. CK, creatinine kinase greater than 5,000 or 10,000 above, yeah, that's rhabdomyolysis. So this patient is in trouble. I do not want to put what? Muscle pain, so that I will give you that way. Creatinine kinase is the protein of the muscle. When muscle get destroyed, it will leak into the blood, and 20,000 is too high. So 1 and 7 are your key. If you don't know it, select or apply. Pick those that you know. Don't pick, if you don't know, just don't guess. Just leave it. Okay, pick those you know. Number 17. The nurse is caring for the following client. Which client situation need immediate intervention? Same thing. CHF, heart failure. Your BMP should be greater than what? 100. 25,000. I don't care about the number. It's fine. If you're receiving blood transfusion and your temperature is 100, this is the most common signs and symptoms. We call it febrile symptoms. Okay? It's number 1. If I tell you patient has back pain, yeah, they may be having anaphylactic or transfusion reaction. If they have chest pain, okay? If they have tachycardia, all those things. But if I just say fever, yeah, it's just febrile illness. That's number 1. The highest symptoms you will get when receiving. That's why we give them what? Tylenol and everything to help with that. So this and this is good. Metoprolol will cause bradycardia. Patient heart rate is 61. It's still normal. So don't worry about it. If you're on isoniazid, your side effect is what? Peripheral neuropathy. It's complaint of what? Numbness, tingliness of the hand. That's normal. This is what I told you. You have to be sharp. If it does not make sense, yeah, you have to figure it out. Go back to the pathophysiology. I've I've eliminated up to 4, therefore I'm left with 5. I got to pick it. But this is the concept. I told you, I've explained this already. Pericarditis and narrow pulse pressure. I intentionally said in this question, the only thing you worry about this again is cardiac tamponade. And what are cardiac tamponade signs? JVD, okay, muffled heart sound, right? And hypotension and pulses paradoxical. But one of the other ones is narrow pulse pressure. What it means is your systolic blood pressure is getting closer to your diastolic blood pressure, or diastolic getting closer. So somebody with a blood pressure of 120 over 110, I'm worrying about that patient than somebody whose blood pressure is 90 over 40. There is a pulse pressure here. There's no pulse pressure. When your diastolic is getting closer to the systolic, it means your heart is not pumping. It's not pumping. It cannot pump at all. So this patient is in tamponade. Number 5 is your problem. Number 18, same concept, divided. This may be the one of the others one, but you have to look at it carefully to figure out. It's select or apply. That means there's multiple. It's pharmacology. You got to bring your pharmacology and use your pathophysiology to answer it. Client on isosorbide. What does that mean? Isosorbide is nitrate. That means I should avoid nitrate at all costs. Prescribe what? Caladifil. I call it the fields. It fills the spongiosum of the penis used for erectile dysfunction. Therefore, you can't combine 2 nitrate. You're going to die. I need to see you. Client on warfarin now prescribe sucralfate for peptic ulcer disease. Sucralfate can affect absorption of warfarin, no matter how teaching you provide them to take don't take the sucralfate 1 to 2 hours before you take warfarin. They're going to get into mistake. They'll have a mistake. They'll get into trouble. So don't even combine them at all. Client on digoxin now prescribe nifedipine cream. One of the things you should avoid digoxin is calcium channel blocker. This is calcium channel blocker. And digoxin, they are enemies. Fluvoxamine. Do you recognize this? This is SSRI. Now prescribe sumatriptan. Pharmacology, drink it. Sumatriptan is used for migraine. How does it work? Increase serotonin. We have increasing of serotonin here and serotonin here. You can combine. You're going to have what? Serotonin syndrome. We got to see you. Client on lithium, now prescribe risperidone. This for acute mania. This is a concept you're supposed to know. Don't only focus on lithium. When somebody is in acute mania, we put them on lithium, but they also need second generation antipsychotic. This is second generation antipsychotic. So this is okay. Don't worry about this one. So 1, 2, 3, and 4 are your right answers. This is concept pharmacology, pure pharmacology. If you know it, if you have a problem, check my YouTube site. And next is caring for the following client. Which client situation need immediate intervention? Same thing. We've seen this multiple times. There is something I'm trying to dig into your ear and tell you that when you see this, it's a freebie question, easy question. You pick it and you keep on moving. Client with appendicitis, itis. I expect you to have pain, so don't worry. Cholecystitis, itis. I expect you to have fever. Don't worry. Pancreatitis, I expect you to have abdominal distension. Don't worry. Baswed, abdominal rigidity, and itis with abdominal rigidity is peritonitis. All these things, you worry about peritonitis. Pancreatitis, you also have to have lung problem. Number 4 is your right answer. And the last question. Last question, following the same thing to tell you some of the words they can put, but you have to make the diagnosis and figure out. You have diverticulitis and the board-like abdomen. This is peritonitis, another way of saying it. So we got to see you. Pancreatitis and I have periumbilical ecchymosis. So this is periumbilical ecchymosis. This is Kelly sign. Patient is bleeding. Intussusception and a large brown stool. This is to trap you. Even though they have intussusception, now they're having large brown stool. What do you expect? What kind of stool do you expect intussusception? You look current jelly stool. And what is that? Mucus mixed with blood and stool. This is not what I said. He said large brown stool. This patient is okay. Patient with peptic ulcer disease and sudden 10 out of 10 mid-epigastric. This one is perforation. If you have epidural hematoma and you're vomiting, you have ICP problem. You're dying. These are all concepts. If you don't know it, just leave it. But I want you to pick them because you know it. I've given you enough information. 20 NCLEX review concept or prioritization. You should master this. This is part one. This is part two that is coming. I need you to ace this test. So take care of yourself. If not, please subscribe, look down and click it, and check Adapt NCLEX and make yourself comfortable. All the best of luck and keep charging as always. If you have any comments, just send it to me and I will see what I can do. All the best of luck. Bye.